So this is going to be a conversation on malaria elimination, looking into more the scientific innovation and opportunities. It was mentioned in the morning also, as we observe the World Malaria Day tomorrow, the theme stands towards investing, innovating, and implementing. So to outline areas of research and innovation that are critical for achieving malaria elimination and identify essential steps in scaling up innovation in relevant countries. We have our distinguished speakers, Dr. Anup Anvikar, the Director, Indian Council of Medical Research under the National Institute of Malaria Research, Government of India, Dr. Philip Welkhoff, the Director, Malaria Bill and Melinda Gates Foundation, Dr. Kamini Mendis, from the APLMA board, co-chair. May I request to please join. And our session moderator, the CEO of the Asia Pacific Leaders Malaria Alliance, Dr. Sarthak Das. So So we have Dr. Kamini Mendis joining us. May I just once again request people who are standing, if you can please take your seats. We request for little utmost attention of yours as we take this conversation forward. Thank you. Handing over to our moderator, Dr. Sarthak Das.
Thank you. So it's the last session of the day, and I think all the sessions have been amazing, but I know that this is one certainly I've been waiting for many months, and I feel quite lucky that I get the chance to be on the dais with all of you. In the last few years alone, some of the technologies that have been in the pipeline are slowly becoming available at scale. These include tafenoquine for radical cure of Vivax, point-of-care tests for G6PD deficiency, malaria vaccines, gene drive, mosquito technology, PBO nets, attractive toxic sugar baits, and more. These tools have the potential to change the trajectory of malaria elimination in the region. Many are still under-researched, poorly understood, and certainly access remains a major issue. There are also questions in regards to the current abilities of many countries to absorb some of these new technologies. So the way that we're going to do this session is meant to be more of a conversation with three of the world's most distinguished speakers, I think, in malaria with me today. And what we're going to try and do, or we will do, is discuss key innovations in the pipeline, their relevance for malaria control and elimination programs in Asia Pacific, and what these experts think countries could do, need to be able to do, to both improve access while building capacity and ensuring the adoption of these tools. So with that, I'd like to introduce the panel. First, it's my pleasure to introduce Dr. Anup Anvikar, Director of both the ICMR National Institute of Malaria Research in Delhi and the Director of the National Institute of Biologicals, Noida. Dr. Anup Anvikar brings with him a wealth of malaria research experience, and we are just thrilled to have him on stage. Thank you, Dr. Anvikar. Next, we have Dr. Philip Welkhoff, Director for Malaria at the Bill and Melinda Gates Foundation, who has been leading the Foundation's global strategy for malaria since 2018. As many here would already be aware, malaria eradication is a top priority of the Foundation, and over the last 2 decades since its establishment, the Foundation has contributed, it says greatly, I would say immeasurably, to the global fight against malaria, particularly in catalytic efforts and in assuming risks that would be more challenging for others to take. So thank you, Dr. Welkhoff, for making the long trek here to Delhi. And last but certainly not least, it's my pleasure to introduce Dr. Kamini Mendis, board co-chair of APLMA and also a member of the WHO Malaria Elimination Oversight Committee. Dr. Kamini, as many of you may know, is a renowned malariologist, medical scientist, and public health expert who is well known for her contributions to malaria science and research and training to new malaria scientists. She advises several Southeast Asian ministries of health, including Sri Lanka and international agencies on tropical medicine, health, and disease. In 1998, Dr. Mendis helped launch the WHO's flagship advocacy entity, the Rollback Malaria Initiative, as I like to say, our mothership in terms of advocacy. She also worked as a senior professional in the WHO until her retirement and served on WHO's Malaria Policy Advisory Committee until 2018. Thank you, Dr. Mendis, for joining us. So with that, I'd like to start off with you, Dr. Anvikar and Dr. Welkhoff. For you, Dr. Anvikar, first. Could you speak to one or perhaps two innovations in the malaria pipeline of research at NIMR or others that you are funding through the Institute that you're the most excited about?
Yeah, thank you very much, Sarthak, and thank you for organizing this conclave. It has brought together all the partners and will definitely help in the future roadmap for our journey towards malaria elimination in the Asia Pacific. So I won't restrict myself to my institute, but about my country and our region, Asia Pacific region. Well, there have been many innovations in the areas of diagnosis, treatment, vector control, surveillance techniques. It is really difficult to name one or even two. Everything is equally important. But let me tell you a little story. When I was a kid, when I used to get fever, there used to be one local worker who used to come to our house. He used to take a blood smear and he used to tell my parents that, okay, I will get back to you. He never got back to us. I don't know, maybe I never had malaria, or maybe he might have known after 5 days or 10 days that I had malaria. But by that time, I might have recovered. But today, it is really great to see the health workers, the local village health workers. We call Ashas in India. In some parts, we call them Mitanins, might be having some other name in other countries. So it is really great to see them going to the house of the people and test them then and there, and if the patient is positive for malaria, administering the anti-malarials. So this RDT had been a really great invent. And it is really great to see surveillance turning into a core intervention over the past many years. And many innovations had been there. Means we have been talking about poor access for so many years. But then in the past 7 or 10 years or so, we have really had good innovations to improve the access. The people have mapped what the definition of access, what was actual point which was preventing the access to the malaria control commodities or tools, means whether the health worker is not receiving the commodities or whether health worker cannot reach the patients. And we have actually worked on them. If I talk about India, my friend Madan Pradhan is sitting here. So there was one project with MMV, WHO, Kamini was also very much part of that project, and it was called as CCMP, Comprehensive Case Management Pilot. And the interventions were really great, and then Madan invented this Daman, a program to improve the access, and which has actually helped reducing the burden in Odisha. So I will say surveillance.
Great.
Thank you.
Dr. Welkhoff.
It is hard to pick one, just because I think it's a really exciting time in malaria research and development. I think it's not an exaggeration to say that our innovation pipeline has never been as strong as it is right now, and it's very exciting to see many of these innovations now coming out and start to have real impact in the world. I think the one that I would mention most specifically would be around tafenoquine, where having an effective radical cure for vivax malaria and relapsing malaria has been such a challenge for so long. But the progress in terms of being able to actually have a single dose treatment that actually cures and clears relapsing malaria is a remarkable accomplishment. And the fact that it wasn't just the drug work that had to be done, but the work of a point-of-care diagnostic alongside to allow G6PD deficiency to be tested so that the drug could be used safely and effectively, it's been very nice to see that united research project going forward. And I think when we see what is a key breakthrough in the result of well over a decade of work by many researchers and product developers and implementers around the world, tafenoquine and G6PD testing is there. I'll just mention one other thing in parallel to that, is we know that just as in pretty much every area of health, an effective approach to health has both treatment of disease, but also a key emphasis on prevention of disease. So when I mentioned on the tafenoquine side, that is a major step forward on the treatment side. But maybe later on this session also we could talk about some of the major steps that innovation is doing in terms of advancing prevention, whether through different forms of vector control, improved bed nets, attracting targeted sugar baits. But it's very nice how in the R&D portfolio right now for malaria, we're making great progress on both the treatment side and on the prevention side.
Great. Dr. Kamini, anything to add in here from your...
I was hoping you wouldn't ask me because it's difficult to come last. Surveillance has been taken, RDTs and tafenoquine and G6PD. So I'll have to go with a vaccine, I'm afraid. Though it's commonplace and everyone loves vaccines, I think it's a very, very important tool to tackle the residual burden of malaria, especially also in the Asia-Pacific region. For very good reasons, the efforts have been focused on Africa, and I think that's wonderful. But I think particular types of vaccines, like pre-stick vaccines, will really make a difference in this part of the world, because the residual burden of malaria is in special groups of populations in this part of the world. It's the migrant populations, it's the forest workers, it's the hard-to-reach groups. And, I mean, a vaccine would make a tremendous difference, I think.
So you led into my next question, and I'll turn to you, Dr. Anvikar, again. So what areas in Asia-Pacific specifically do you think most urgently need more innovation?
Okay. Little difficult question. Definitely the areas where access still continues to be a big challenge. Mm-hmm. And if we talk about Asia Pacific, we have all sorts of different terrains. We have small islands, we have forested areas, and they are making the access difficult. So if I talk about, say, India, there are many forested areas, maybe say in the states of Jharkhand or Chhattisgarh, Odisha. So these forested areas, they have very less population, but then they contribute to more number of cases. So mm-hmm. These are the areas, hard to reach areas, which will need more efforts to be put in, and will really need innovations to improve the surveillance across the region. Let it be Indonesia, let it be India, or whatever.
So, to you, Dr. Welkhoff, similarly, I mean, in terms of areas in Asia Pacific that you think need more innovation, or giving you the chance to speak to some of the other innovations that you mentioned and how, based on your understanding of our region here, what might hold good promise or be important?
I think one of the real important frontiers for increased investment in research and then translating to product development will be around vector surveillance. The understanding the mix of species that are transmitting in different areas. It's such a complicated set of different species with different feeding behaviors, whether it's around the household, earlier in the evening, indoor versus outdoor. And I think there's just a lot of work that needs to be done to understand that tremendous heterogeneity across countries, within countries, even from urban versus rural and in harder to access areas, making sure that the approaches that we're developing and deploying are actively tailored and respond to the local entomological situation. So I think there's some real important opportunities for improved entomological monitoring, improved entomological surveillance, building that and exercising that capacity. And then we have some very interesting things in the portfolio, whether it's new ingredients for bed nets or an attracting targeted sugar bait, which is one of our first innovations that is really effective at dealing with outdoor-based transmission or early in the evening transmission by targeting sugar feeding of the mosquito instead of just the blood feeding. So I think we have a very nice mix of tools that can help approach vector control and help on the prevention of infection side, but I think those will really need to be guided by increased investment and exercise of entomological surveillance and research into the mix of species and their feeding behaviors.
Thank you. So when we think about, there are a set of challenges in the research and development stage, but then there's a whole nother set of challenges around accelerating access. And as we've heard throughout the day, we actually don't have a lot of time in many ways, right, to reach the goal that's been set. And so when we think about accelerating on the R&D side, we also need to think about accelerating on the access side and what goes into the ability to absorb. And when I say on the access side, I'm talking about access challenges that could be on financing, they could be on implementation hurdles, they could be on regulatory approvals, they could be related to health workers and their training. And so what kind of access challenges in Asia Pacific are you seeing as being critical ones in terms of a prioritization among some of these or others that I neglected to mention? That's the first part of the question. And if there are any thoughts on ways to overcome some of those challenges, if that makes sense. So, Dr. Anvikar, to you.
So access challenges, a very important issue, Miss. It's not only about improving surveillance, Miss. We were talking, when we talk about surveillance, it is mostly related to the delivery of an intervention. But the discovery stage and the development stage, they are also equally important. And traditionally, we have seen that if, say, for example, a vaccine or a medicine needs to be developed, well, first of all, for discovery, a lot of time is required. But then even for the development, it takes around 5 to 10 years. See the example of tafenoquine. Since how long we are hearing that the world is going to get tafenoquine. But then it's now that few countries are getting that. So, but then with COVID-19 pandemic, we have seen that the time lag between the discovery and the delivery was really reduced. There were no more red tapes because it was identified as a global public health problem. And with the same pace, if we are applying the same principles to the other diseases, that will definitely be helpful. And we really hope that the development of malaria vaccines or some novel tools, say for example monoclonals or whatever, so they will be very rapidly developed, and the regulatory mechanisms will also be fast. So the example of COVID-19 pandemic management should help us in cutting short the time required for development. And now, of course, we have the political commitment, and people are no longer seeing these expenses as expenditure, but it is looked at as an investment for better tomorrow.
Thank you.
Thank you.
Dr. Kamini, thoughts from you on accelerating access in any particular area that comes to mind that should be prioritized?
So I think both my colleagues have mentioned the important ones. I think we too often ignore supply chain management. You know, if you really analyze the barriers to access, a lot of the time it tends to be that clinics don't have medicines and diagnostics and vector control interventions, and all too often. And it should be a simple thing to solve, but it unfortunately isn't. And you know, we talk about behavior change and we invest in things like that, asking communities at risk to seek treatment. But you know, I think they're quite good. They will seek treatment and they will go to a clinic. The problem is the clinic doesn't have what is needed to treat them. So they don't go to the clinic, they'll go to the quack, the nearest quack. So I think supply chain is all too often forgotten as an important part. And now with advances in digital health and so on, I think there's a huge opportunity to bridge that gap. And you know, it stems from procurement to delivery at the periphery. So I wish people like us would focus a little bit more on supply chain.
Thank you for pointing that out. And just to say, I mean, for many people who also may be familiar with so much of the work that happened 10 years ago around HIV, to think that supply chains were extended and people were trained in a complex chronic infectious disease and pediatric formulations even,
exactly.
and the dosing and what's involved in the cold storage and what needed to happen along that chain. And it was in many ways successful. I mean, there's room for improvement, but supply chain was a core part of that. And so in that spirit of not being silos, maybe there are things that you know, we can learn. But thank you for bringing that up. And to you, Dr. Welkhoff, any thoughts in addition on this issue?
I love each of those answers, and I think those are such key aspects. I think when we think about where are there gaps in access, there are often, the gaps in access are most noticeable or maybe insufficiently noticed for the most vulnerable. And when we also see what happens as progress is made against malaria, malaria becomes increasingly concentrated among the most vulnerable. And so where the problem becomes increasingly concentrated and the burden becomes increasingly concentrated happens where we have often as a system the least observation of the true challenges and often the least reach for delivering and providing access. So I think recognizing that, we need to recognize the both geographic and demographic heterogeneity across and within countries. We need to strongly improve surveillance, because as we make progress and the heterogeneity increases, we can't just do the same thing everywhere. We have to understand where are those remaining pockets, where is the remaining burden at an increasingly granular level. That requires improved spatially and timely accurate reporting of cases, and then programmatic response there. And then I really appreciate the call out to digital health, because when you have the improved resolution of where you're remaining, where you need to be focusing your remaining effort, there's been remarkable progress. I think we see the great progress in leadership happening here within India, and the innovation to develop and then deploy digital tools to ensure coverage, and ensure coverage gets to those who need it most. And I think when we couple the improved surveillance to the digital tools for delivery, we end up with a very powerful way of ensuring that access gets to those who need it most, who often lag in terms of access, lag in terms of coverage, without sufficient ability to observe that gap that persists.
If nobody wants to answer this, and this is a question that I just thought up, so we can keep moving, but while I have the three of you here, it just occurred to me in this discussion around access. You know, I was reading about this app that's an AI-powered app to detect disease on banana leaves, and how it's been a game-changing thing in parts of Central America, because the diagnosis of what disease a particular plant might have has changed the way, and many people may be aware of this, has changed the way that people are able to then care for their crops. And so I'm by no means an expert, but do any of you have thoughts on or insights into, let's say, an area like entomological capacity and this wave that's happening around AI? Are there things that any of you are aware of, or are there things that you see down the horizon as ripe areas that we all should be thinking about?
Yeah, AI has been one of the great interventions, and a great tool that has been helping across the diseases. And if we talk about malaria, I saw many youngsters, startups coming up with devices which will catch the mosquitoes, trap the mosquitoes, identify the mosquitoes, will count the mosquitoes based on certain parameters, and tomorrow, maybe after a couple of years down the line, we will have those in the field, and which will be helping us. See, recently I saw a device that could say trap around 12, 13 different types of insects, and saw one device which could identify which mosquito it is. But of course, we will have to feed different images and videos of the, we will need to develop. But then yes, AI is the future.
I don't know. Do you have any further comments?
I think there's some really exciting work happening right now in terms of using processing of auditory signals to detect and then identify mosquito species. We know that there's a tremendous range of differences in terms of what are the frequencies of wing beats for different species of mosquitoes. I think when we add the additional information on top of that, because it's not just what are the frequencies, but all the harmonics on top of that, just in the same way that we can hear the difference between a violin and a piano playing the same note, even at the same frequencies, it's interesting in terms of the different mixes of frequencies and harmonics that define a mosquito wing beat. And so I think there's some very interesting work in terms of using artificial intelligence and sounds that could be collected from cell phones to help understand what are different mixes of species. So I think it's a very interesting frontier. I think it's moving quite fast, even on a month-by-month basis. But it will definitely benefit the community to leverage those things wherever we can.
Thank you, and thanks for entertaining the question. So we've talked about some of the access barriers, but given the assembled group that we have here, and I think it hasn't come up enough today as well, we have a whole world of people who are watching online and joining this meeting. And so important to acknowledge them as well. So this next question is really about what you all see as the role, whether you're in the government, whether you're part of civil society, whether you're a donor, what responsibilities do we have in working together to accelerate the access to new tools? Any thoughts? I can start with you, Dr. Anvikar. Yeah.
Yeah. So when we talk about the different partners and their roles, so collaboration is the key to move forward. All partners need to work together in order to improve the access. Say if there is a medicine, then there will be different stakeholders like say the industry, before that the R&D unit of the industry, the CROs, research organizations, program, then of course donors. So everyone has to come together so that we deliver that particular product in a timely manner so that it is useful in managing a particular public health problem. And the role of different partners should be complementary to each other. And there shouldn't be any duplication, and all must come together so that we can deliver the product. And we have seen many examples in the past also. Means let it be the development of the, say, I will take the example of the ACTs. There were donors like BMGF or many others. There was WHO which was facilitating the things. MMV was acting as a catalyst. The industries were supplying, means R&D units and industries were giving the molecules. Then industries were taking up the technologies to manufacture it. Then for improving the access, many implementation studies were done by many many of the organizations. I could see at that time MSF or even MMV or CHAI acting towards improving the access. And of course, there were the governments which were the biggest takers of these technologies. And due to the partnerships, the strong partnerships, we have seen whatever success we are able to see today.
Thank you. So building on that, Dr. Kamini, as the person here was there at the inception of rollback malaria, and what Dr. Anvikar is describing, really to build on that, two parts. The first is what did you see, what did you observe as being central to making collaboration, that kind of collaboration, effective? And one way to potentially answer that is, which I didn't get to, is what are some of the best examples you've seen, whether it's in a country, in a subset of countries, of that collaboration actually happening to take the best of what's new, but meld it with the kind of leadership that's needed?
Yes, I think I can speak to this at two different levels, Satak. At a global level, I think when we launched rollback malaria, this was in 1998 in WHO under the leadership of Gro Harlem Brundtland, who was the then Director General of WHO. Before that, malaria was handled in WHO in a sort of very isolated technical way. And I think it was she who brought in this entire concept of it has to be a partnership. So she brought in immediately 3 UN organized agencies, UNICEF, World Bank, and UNDP, WHO. So that was a beginning. And that made a huge difference, I think. And from that time onwards, and Corinne Karema is there in person, rollback malaria, the partnership has thrived, and that's the way we work today. At a country level, we often say, I've heard the word intersectoral collaboration used in so many meetings today, so many times. But I think it has just become a mantra, and it's nice to be able to put some real meaning into it. I come from Sri Lanka, so I hate to use the examples from that country itself. But I think one of the best intersectoral collaborations I've ever seen has been in the elimination effort in Sri Lanka. And Risintha Premaratna, who's now the regional advisor in CRO, was the program manager at the time in Sri Lanka. And it was truly an incredible collaboration. You know, it was with the Ministry of Defense, because malaria happened to be in the army, in the air force, because these people were soldiers working in forested areas, and the residual burden of malaria was in them. So the collaboration between the malaria control program and the army was so good. I mean, the top officials of the army would come to a meeting of the malaria control program. I've never seen that anywhere. And they cooperated so well. And not only that, with now, today, even today in Sri Lanka, which is trying to prevent the re-establishment of malaria, it's not UNOPS, it's IOM, the International Organization for Migration. It informs the malaria control program every time a group of asylum seekers come to the country. So they send a list of people to the malaria control program ahead of their arrival, from where they're coming, where they're going to be housed, and the malaria program then immediately gets into action. They're ready to screen them, they're ready to go out there and take histories and follow them up in case they get malaria. So I think in implementation, it really is an important area, intersectoral collaboration. Not just words, but action. And I think it's extremely important, really, because everyone says it's not just a health issue. That's not good enough. It's primarily a health issue. So the Ministry of Health has to take that leadership, because the Ministry of Agriculture is not going to come behind malaria, chasing malaria, no, unless you reach out to them. So I think that's something I've learned over the years, just observing these excellent examples.
Thank you. And so I'm going to, the same question, Philip, but just I want to open it a little bit. And I think Dr. Korean said, about learning from Asia Pacific and what's been accomplished. And I think that's, of course, absolutely correct and fair. But when you, from your vantage point, because you get to be having a very singular global view on what's happening in malaria, and I think it would be great to also hear about examples of, you think, excellent collaboration and partnerships, not just here, but from sub-Saharan Africa or elsewhere, that you think would be beneficial for the group to hear about in terms of multisectoral collaboration, best practice of adapting innovation, any of those things.
I think there's a couple key elements that have to come together, and I really appreciate each of those sets of examples. At a fundamental level, for us to succeed against malaria, there will need to be improved access to healthcare in all portions of the country and for all populations. People don't come to seek healthcare with malaria. They come with a mix of symptoms. They may come with a fever. And making sure that across sectors, but with health leading, but health not leading just in a malaria siloed way, but saying we are going to extend access to care to each population that needs that. And I think we see what that means looks differently in different countries and for different demographics. I think we see some real innovations in terms of extending access to care to forest malaria workers in Southeast Asia, in Cambodia. I think we see remarkable work in terms of extending access to care in Sri Lanka with different challenges for different parts of the country, for different demographics, different professions. I think the military example is a really important one within that. I think but we have to look at this and we have to say, who has access, who doesn't, where do we need to make further progress, where is there an equity issue, where a population or a geography may not have timely access to the right diagnosis and an effective and timely treatment. Our tools work, right? Our ability to diagnose works, our ability to treat works. And malaria alone as a community can't extend access to all the places that are needed. So it was great to hear some of the examples from the health secretary today around ways in which here within India, access to care in a cross-cutting way is being extended in ways that are better than ever before. I think there's some of the other examples is how do we leverage and engage the private sector? Because I think where we've seen a lot of success in terms of not just driving down burden by a long way, but getting all the way to zero, is when both public and private sector come together, not just to ensure quality of diagnosis and quality of treatment, but also gather the reporting back so that the national programs know where any residual problems, residual cases persist. And I think there's quite a few examples of that, but that's one to get very specific about, is in terms of very clear and systematic engagement of the private sector. I think the last one that I would just want to, another one that I would just want to mention is just the remind that malaria is very unforgiving. And any complacency, and even without complacency, when things go wrong, say with a outbreak with a pandemic, financial crises or economic downturns, we can make progress against malaria because our tools work, but that's only as long as we're able to keep systems working and keep deploying these tools until we get all the way to zero. And I think just recognizing that fragility of progress, unless we keep making, unless we continue on all the way to elimination, is a key thing. And placing that malaria fragility or the unforgiving nature of malaria against the backdrop of climate change is I think a stark warning for all of us, not just within malaria, not just within health, but in all of society, that there's a real urgency here. We see what happens when there's flooding, when there's natural disasters, or when there's mass displacements of individuals. Malaria takes advantage of each one of those things. And the backdrop of what the coming decades look like is for those incidents to get worse and more frequent. And I think that sets a sobering reminder for us that as unforgiving as malaria is right now, and how there's no room for complacency now, there's a real urgency to drive that progress much further, because those challenges are going to get worse. And there's an impetus for that all of society to really come together in this moment and recognize that eliminating malaria, having an Asia Pacific free of malaria, is one of those best things that we can do in terms of being resilient in the face of climate change. So I would just, those are a couple of those things that I would just emphasize. We could talk for much more about that, but those are some specifics.
Thank you. I want to make sure that there's time for questions, because we're getting kind of close to the end here. But one point and question I'd like to just throw out, and I'll start with you, Dr. Kamini. But so there's these amazing innovations that are in the pipeline that have potential to dramatically accelerate progress, provided we can resolve some of the issues around access. At the same time, we're sitting in a region where, as you pointed out, Sri Lanka, where we can't ignore China, which eliminated malaria last year. You have Azerbaijan, Tajikistan. What would be some things you would say that we should be thinking about to balance the ideas around new tools? At the same time, we've done this. And so I think your insights into that question would be greatly appreciated, and then either of you as well, but for you.
So thank you, Sathak. I'm glad you asked, because exciting and hopeful though the promise of new interventions are, I think we should remind ourselves that several countries in, for example, the Asia-Pacific region have either very successfully eliminated malaria or are very near elimination. And they've done this with existing tools, let's not forget that. Um, and you know, let's not say that in these countries things were easy, that there was no malaria. I mean, you could always say Sri Lanka is a small country and it's an island nation and it doesn't have to worry about land borders. But you know, Sri Lanka eliminated malaria during a brutal civil war. Let's take Timor-Leste. I mean, that's a small country. Again, it's an island, but it has a land border with a very highly malarious country on the other side, West Timor, okay? And as you know, Timor-Leste is a young country, and it didn't have a fantastic health infrastructure to begin with. But it was that commitment and determination, and they did it. And the real prize is China. I mean, China, with its vastness, with all the complexities that malaria offers. You know, it is land borders with so many countries that have a lot of malaria. It sends out its people everywhere, including Africa, highly malarious countries in Asia. They bring it back. You know, so they used existing tools. And I absolutely agree that in some situations that are difficult, it would be tremendously helpful to have better tools and newer ones. But let's not wait for new tools, please, to eliminate malaria, because time is very costly. If you wait 5 years for a new tool to come along, you never know what problems those 5 years might bring, new problems, drug resistance, insecticide resistance. So I think the most important message we want to give to the countries is it's possible to eliminate malaria with existing tools. And it is really, really important to do it now, not tomorrow, not 10 years' time. The time is now, and it really requires a commitment and a disciplined approach to work. I mean, that's, I hope my colleagues would agree with me.
So before we go to questions, Anup, any parting thoughts?
Yeah, miss, if I talk about the tool, miss, I really dream of, say, a malaria vaccine which will be effective against falciparum, against Vivax, which will also prevent the transmission. But then that will take many, many years. But whatever tools we get, still one important tool is going to be most important, that will be again surveillance. And access to whatever tools are available to all. As we talk during the SDG, that access to all the people of all the ages. I don't remember the exact wording. So we must not leave any part of the community maybe by the virtue of its geography or terrain or whatever.
Philip, any last thoughts?
No, I just very much appreciate the call to urgency. I think we can eliminate malaria with these tools that we have, and I would also say that as we get new tools added into there, having that same urgency towards introducing and deploying those new tools in parallel is a great opportunity as well. We saw what could happen during COVID when there really was an emergency footing to introduce, scale, and deploy and provide access to those tools. And I think if we look at those things that are not just at scale right now, but are available, but yet not scaled, and include that within the context of things that are considered presently available tools, I think we can do remarkable things on quite short time scales. And it does take that collective urgency, though, to actually accomplish that promise.
Thank you. So with that, I'll open it up for a few questions. I know it's the end of the day, but yes. Go ahead. Do you need a mic? Okay. You're going to shout?
I'll say that key part again. How can we make health systems sexy? Because a lot of the delegates this morning mentioned health systems. Our colleagues from Solomon Islands said malaria elimination is not possible without health systems being in place. And I'll clump in regulatory processes in there as well, because some of the regulatory processes can take as long as some of the R&D. It's really key to get these processes and systems in place for these new tools to be effective. So my question is, how can we make that sexy again? Because often we talk about health systems and processes, but we kind of just assume that they'll be there. It would be great to know how we can really strengthen those to allow new tools to work.
Caroline, so the question was, how do we get the health systems to be a little more effective? Is that right? I'm sorry? Right.
So how can we make them exciting for people to want to invest in to make sure these tools can work and be flowing through those systems, like supply chains,
Right.
but also like high quality training?
Right. I mean, I can turn that on its head and say, you know, what is health systems after all? Health systems is the system that has to respond to many health conditions, right? So I would say, why don't we make, by improving the response to malaria, you're strengthening the health system in a way. I mean, it's just the opposite of what we usually say. I mean, I say this because I know I've heard during the malaria eradication, global malaria eradication program of the 1950s and 60s, it's said that in many countries, the health system was built because they established malaria clinics in remote rural places in those countries where no clinic existed, and that the health system was built on the response to malaria. So it's slightly putting it around in a way. So, I mean, this doesn't answer your question adequately. You know, Caroline, I think waiting for the health system to improve, I don't think we'll ever get there. I think we'll just have to use the response to malaria to strengthen that system, and not working outside the system, but within the system. So if, I mean, a colleague of mine, Dr. Tori Goodall, whom some of you may know, used to say that when we launched Rollback Malaria, he used to say, give countries money and say, you can, this is for malaria, you can use it in any way you like, strengthen the system. It doesn't matter if you strengthen the system for X, Y, and Z. Never mind malaria. But what I'm going to measure at the end is malaria outcomes. Okay? So that's a very smart way of doing it. And I wish there was more follow-up on that. So I really think malaria, my personal experience is, if we ask the health system to be strengthened by someone, I don't know when it'll happen. It'll never happen. We better do it ourselves through whatever disease we are going to address. But that may not be a good answer.
No, but then you raised very important issue, and a robust health system is a key to tackling any public health problem, not only malaria. Say, say I take the example of a village level health worker. If he has got all the commodities right, in fact, you answered the question itself. Means if the supply chain is robust, then the health workers or the health facilities will have all the supplies available. There will be no stockouts, and thus people will believe more into the health system. So we definitely need to work towards strengthening the health system in terms of everything. Means ensuring that there is adequate manpower, the manpower is well trained, so capacity building is absolutely important. Then we are developing the facilities, taking the facilities to the lower level. Say for example, if we talk about say simple investigations like blood sugar or checking the blood pressure. So what's the harm in taking these facilities also to the village level? So it's not just only about malaria, it's overall health system, and wherever there had been any disease elimination, say for example Sri Lanka, it's not that they have just worked on malaria, means say, with malaria, so they were able to reduce the prevalence of other diseases as well. Yes, so robust health system is a key to tackle the public health problems.
The one thing I would add, and agree with each of those comments, is all the highest degree of difficulty eliminations have been associated with a strong emphasis on increasing access to care or building off of an increased access to care, whether this was the Barefoot Doctor program in China and eventually seeing 137 progress from there, whether it was all the tremendous work in Sri Lanka and so on. Improving health systems and access to care is a key thing there. I think we can't sit and wait for health systems to get better. I think there's recognizing the bidirectional links between malaria and health systems is going to be really crucial. There are certain malaria indicators that can almost be vital signs for the health system overall. What fraction of fevers receive the right diagnosis? What fraction of diagnosed malaria receives the right treatment, and so on? And do those cases get reported centrally and tracked? Do we see, and so I think there are some things where, as we work to drive those progress, certain malaria indicators can provide a cross-cutting value to that overall health agenda. And as we make progress on using digital tools for making sure that coverage gets to all populations, including the most vulnerable, I think it won't be just malaria that benefits from that. So when we don't just have them as separate topics, but recognize the true bidirectional interdependencies, I think we can help to drive more progress than we would otherwise.
Any other questions? Yes, Dr. Valecha. Thank you. Microphone behind you.
So we have been talking about access and new tools. I mean, they can be used appropriately when we know where they are needed. And so when we talk about large countries, as Kamini said, at subnational level, the endemicity varies so much. So we have to know exactly the situation at each level. So I believe data management systems and that too very prompt information can be the key of using these tools and the other surveillance or whatever we say. And we can learn from example of COVID. Countries can do it. We know large countries, including India, within 24 hours, all information was available, whether it is death, even at district and subnational levels. So I think that can really help and supplement in achieving elimination when we are talking about tools and access and other technologies. Thank you.
Thank you. We can take one more question. Yes.
Yeah, here we are talking of tools of health. Do we include in this nutrition also? Wherever is malaria is there, malnutrition is a big issue. So where we have this type of relationship?
When we talk about, say, malaria, and we many a times say malaria is a disease of poor or something like that. And when we talk about improving the access to malaria control tools, or when we talk about empowering ASHAs for, say, tackling malaria, these healthcare workers are not only dealing with malaria. So they are also involved in IEC. So they are involved in even imparting education. So it is overall health. And when we talk about malaria, there are many programs going on in parallel. And definitely nutrition is also, as far as the education regarding nutrition is concerned, so that also is taken care of. Secondly, the country's GDP is gradually, it is increasing, and it also takes care of nutritional aspects also.
Okay, well, I think we're on time, maybe perhaps a little bit. I traveled all this way. Any other parting thoughts? Anything else that anyone wants to add? No, I think we've said a lot. I think there'll be dinner later. So with that, please join me in thanking the esteemed panel here. And I think we have some gifts for you all. That's right.
So thank you to our esteemed speakers for this excellent conversation which we had. Thanking Dr. Sarthak Das for moderating it, and may I request you, sir, to kindly present these gifts. Requesting Dr. Sarthak Das, if you can, yeah. Thanking Dr. Philip, thanking Dr. Anup Anvikar. And thanking Dr. Kamini Mendis. We'll close with a group photograph of all of you. Okay. So, thank you once again. So commitment and discipline, and as was mentioned, time to act is now. So with all the